In the review on catheter ablation of atrial fibrillation of this journal issue, we are reviewing the current knowledge about this therapeutic strategy in the clinical field. In particular, we are referring about the aggregate data analysis that has been performed by several groups in relationship with the benefit that catheter ablation may generate in patients with atrial fibrillation when compared to the traditional antiarrhythmic drug treatment. Recent meta-analyses have clearly shown that the benefit of catheter ablation can be tenfold higher in patients undergoing catheter ablation as compared to those receiving the traditional antiarrhythmic drug treatment. This figure may be as high as 15-fold higher efficacy for catheter ablation if only paroxysmal atrial fibrillation patients are considered, and may go down to 9.7-fold higher for patients with persistent atrial fibrillation, suggesting that catheter ablation can be the preferred choice for all patients with paroxysmal or persistent atrial fibrillation who are refractory to antiarrhythmic drug treatment in order to accomplish a normal sinus rhythm. The alternative to the many benefits that this strategy may generate, clearly the technique has a major role. And the main issue is represented by the unanimous consensus that PVA isolation represents as the golden standard of acute endpoint during the electrophysiological procedure. Additional strategies have not been conclusively shown as providers of additional benefit in these patients. And this holds true for both paroxysmal and persistent atrial fibrillation. Finally, the safety of patients plays a primary role. Recent surveys have suggested that the risk of death and complications in this population may be very high, particularly in centers or much higher than expected, up to 1 every 200 patients undergoing this procedure. And this risk increases with the inexperience of centers and operators. So careful considerations concerning the experience and the performance in this population must be taken into account whenever a new program of catheter ablation of atrial fibrillation is considered.